Hello my study buddies. Today we're going to look at how to calculate fluid requirement in a DKA patient. But before we can even do that, we're going to look at the types of fluids that we give in a DKA patient. Okay, apart from the insulin, of course, we're talking about fluids, actual fluids that we give in a DKA patient. So the types of fluids. Okay. So in a DKA patient, we actually give 0.9% normal saline. Okay, this is what we give. And one thing you have to know is that once the random blood sugar drops to about 12 millimoles per liter, we get to switch. Okay, we switch to DNS. Okay, that's something that you should actually take note of. And I need you also to understand that we're dealing with the pediatrics protocol, the protocols of Zambia. So this is how we actually deal with the fluids, okay, in a DKA patient under pediatrics. Okay, so we give 0.9% normal saline, and then once the random blood sugar reaches to about or drops to at least 12 millimoles per liter, then you get to switch to DNS. Okay. So for how long are you supposed to actually give these fluids? Okay, what's the duration? Okay, what's the duration? You give for at least 36 to 48 hours. Okay, so you get to choose whether you give this patient for at least 36 hours or for 48 hours. Okay, and you can give 8 hourly in 24 hours. Okay, or you can give 6 hourly in 24 hours. Okay, this will make sense as we calculate, and then you understand why this is taking place like this. But then you get to choose whether you want to give 8 hourly, you know, like after every 8 hours you give the fluids, or every after 6 hours within 24 hours. I hope that's clear. So now let's look at the formulas that we use. Okay, so the formulas, okay, the formulas that are used when you're handling fluids in a DKA patient. So for the fluid, sorry, I'll be using abbreviations. So for fluid requirements, I'll use FR, okay, or R itself, which is requirement, okay, but you know that it's fluid requirement is equal to maintenance plus deficit, okay, and this fluid requirement is in milliliters, and so are the rest of these, okay, they're also in milliliters. So this is the first formula that you should know, okay, this is what you use to actually calculate the required fluid in a DKA patient. Okay, so the next formula that we'll look at is maintenance. Okay, in order for you to come up with the maintenance value, you also have a certain formula. Same applies to the deficit. So for the maintenance, the formula is 100 mils per kg, 50 mils per kg, 20 mils per kg. Okay, so for 100 mils per kg, you give in for the first 10 kg. You understand soon, don't worry. Then for the next or the second 10 kg, you have to multiply by 50. And then for the remainder or the remaining weight, you have to multiply by 20. Okay, so this is the formula that you use for maintenance. okay? Like the fluids that you use for maintenance. Yeah, so you will understand as time goes by. But then one thing I need you to know about these kgs is that these are the kgs of a patient. So let's say this patient has got maybe 30 kg or 35. Okay, let's use 35. So the first 10 kgs of 30, 35, okay? Then the second 10 kgs. So anyway, when we use the example, you will really understand. So what you do is you multiply 10 by 100. You also multiply the second 10 by 50. And then the remaining kgs, you multiply them by 20. Okay? That's what this formula is all about. Then you get the total, okay, and you add it together. That's what will give you your maintenance. Okay, so you add this plus this to get the maintenance. Okay, so we'll go deeper into this, don't worry. Now let's look at the deficit. So for deficit, you get the percentage dehydration, because we know that in DKA as well, patients tend to have some level of dehydration, right? Yeah, so you get the percentage dehydration by the body weight. Okay, by the body weight of that patient, and then you also multiply by 10. Okay, and this is in mils. So this is the formula for deficit, the fluid deficit. So remember we said that for the fluid requirement, it has to be maintenance plus deficit. Okay, so these are the formulas that you must know, the formulas that you must memorize, okay, whenever you're dealing with these fluids in a DKA patient. So now let's have some examples, okay? And before we even dive into these examples, I also want you to remember that fluid maintenance is given within or in 24 hours. So whatever total that you have of the maintenance should be given within 24 hours. And then the deficit that you calculate is in 48 hours. So it's very important for you to take note of this in order for your calculations to be accurate. You will understand soon, okay? I hope you have a pen and a paper where you're writing all these things. So let's assume that we have a patient who is 25 kg, okay, who has a body weight of 25 kg. Okay, so if you want, you can pause this video right now and actually attempt, the calculations, the formulas that we use, like insert this body weight and everything like that in the formulas that you used. And by the way, you need to take note that in DKA, you always, if there's any form of dehydration in the patient, you must always assume that the percentage dehydration is 10. Okay, 10. And we remember that, okay, 10 is, what can I say? It's about at least maybe severe dehydration or something like that. Yeah, remember the percentage body loss or body weight loss, right? Yeah, so we always assume that the percentage of dehydration is 10. Even if you just take note of any form of dehydration in that DKA patient, just know that whenever you're calculating, you have to assume that it's 10, okay? Yeah, so you can pause this and try to calculate. Also, you can come back to this and try and calculate on your own. Okay, I'll also give you another question that you should try to solve, and I am looking forward to seeing your answers in the comment section. Okay. So we've said that our patient is 25 kgs, right? So we'll start with calculating the maintenance. So we'll say, so before we even put this formula here, 25 kg has got how many tens in it? Okay, I want you to take note of something. So 25, if we divide it, it's got 10 kg. another 10 kg, and then the remaining is what? 5 kg, right? Do you understand how this is coming about? Remember the maintenance formula. We say that for the first 10 kg, you have to multiply by 100 mils. And then for the second 10 kg, you have to multiply by 50. Then the remainder, you have to multiply by 20. So whenever you have a weight, you can divide it like this, okay? So you can divide it so that you see how many tens it has, okay? And then you will be able to multiply accordingly. Let's use the formula so that you see what I'm talking about. So maintenance is equal to 100 mils. Okay, 100 mils by what? 10 kg. Okay, 50 mils by the next 10 kg in that 25. Remember, we're dealing with what? 25 kg, right? This is the body weight of your patient. So 10 plus 10, that's 20, right? Then a 5 is remaining here. So the 5 that is remaining, you will multiply by 20 mils. Okay, so times 5, which will give you 100 mils by 10. That's what? 1000 mils, right? 50 mils by 10. That's 500 mils. 20 by 5, that's what? 100 mils. And together, it will give you 1600 mils. So the maintenance, therefore, maintenance is equal to what? 1600 mils in 24 hours. Do we understand so far? Sorry, you can't see this part here. But in 24 hours. In 24 hours. Okay? Do you see that? Those are your calculations. So the 25 kg was divided in this way. The first 10 kg of that 25 kg is multiplied by 100. The second 10 kg of that 25 is multiplied by 50. And then the remaining kgs in that 25 kg is multiplied by 20 mils. Okay, that's the formula of the fluid maintenance. Okay, always remember this formula here. So we have our maintenance, which is 1600 mils, right? Now we calculate the deficit. So deficit, we say that we have to assume that the percentage of dehydration is 10. Okay, then you multiply by the body weight, which is 25 kg. Then you multiply by another 10, right? That's the formula, remember? So when you multiply this by this by this, it will give you 2500 mils. And this is in what? In 48 hours. Okay? So in order for us to get the amount of fluids, the fluid deficit for 24 hours, you would have to divide this 2500 by 2 to get for 24 hours. You understand, right? Because 48 hours, that's 2 days. Okay? That's 24 plus 24. So if we want to get for just 24 hours, in order for us to add to the 24 hours maintenance fluid, we have to ensure that we divide this by 2. Do we understand that? Yeah, so when you divide this by 2, what will it give you? So 2 into 2, that's 1. Then there'll be, 2 into 2, that's 1. 2 into 5, that's 2, remember 1. 2 into this 10 here. Yeah, we're using that kind of maths. Yeah, so this is in 24 hours. I hope we understand the mathematics that we're doing here. Okay, So this is your deficit. That's in 24 hours. Okay, so now we are going to add the deficit plus the maintenance to have the fluid required for this DKA patient who is 25 kg. Okay, so let us remember our formula, which is fluid requirement equals to maintenance plus deficit. And we found that our maintenance was 1,600. So this is in 24 hours. Okay, so here our maintenance is 1,600. Then our deficit is what? 1,250, right? Meals. So together, what do we have? What do we have? We have 2,850 meals, right? In 24 hours, right? Yeah, that's what we have. So we have 2,850 meals, right? Yeah. So we have 2,850 meals in 24 hours. This is what we give. This is the fluid required. Now remember that we said would have to divide it 8 hourly or would have to divide it 6 hourly, right? You remember that, isn't it? So for me, I'm comfortable with the 8 hourly. Okay, I'm comfortable with the 8 hourly. So for that 2,850 meals, what are we gonna do? This we're giving it in 24 hours. What about in 8 hours? How much of the fluids will we have? Okay, so this is 24x, then 2,850 times 8, right? So over 24 over 24 here. So we have to multiply that. Yeah, so that will be 950 meals. So you'll be giving 950 meals 8 hourly. Okay? Every 8 hourly. Okay, there you go. So that's what you will be doing, and that's how you calculate this. So if this patient has got hypernatremia, you have to ensure that you give half of normal saline, because you know normal saline has got sodium, right? And then hypernatremia means that there's high levels of sodium. So if this patient already has that, then you have to give half. But of course, this has to be consulted. You have to consult your seniors and even the consultants, okay, if need be. Yeah, so let me give you another scenario, and I would like you to attempt this on your own and give your answers in the comment section. So let's say this patient has got 70 kg. Okay, I would like you to calculate this and then give your answer in the comment section. Okay, so that, and I will be able to help you, okay, to verify. But thank you so much for watching. Till next time, and this is indeed how you calculate the fluid requirements in a DKA patient. See you next time. Bye.